Today, we're going to talk about Panoxyl Cream, which contains benzoyl peroxide. This medication is commonly used to treat mild to moderate acne by reducing acne-causing bacteria and causing the skin to dry and peel. It can also be used to treat a skin condition called rosacea, helping to decrease symptoms such as pimples and bumps on the face. It's important to check the ingredients on the label every time you use the product, as the manufacturer may have changed the ingredients. It's also important to be cautious of products with similar names, as they may contain different ingredients meant for different purposes, which could potentially harm you. The recommended daily dosage and optimal timing for using Panoxyl Cream should be determined by a healthcare professional. Before using Panoxyl Cream to treat acne for the first time, check if you are allergic to it. To check, put a small amount on 1 or 2 small areas of acne for 3 days. If you have an allergic reaction, stop using this product and get medical help right away. If you don't have an allergic reaction, you can use the product. There are many benzoyl peroxide products available. Some can be purchased without a prescription, while others may require a prescription. Consult your doctor or pharmacist on the choice of the product that is best for you. If you are using the over-the-counter product to self-treat, read and follow all directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Some products require shaking before use. Check your product package to see if your form of this medication needs to be shaken. If you are using this medication to treat acne, apply benzoyl peroxide to the areas of your skin affected by acne. If you are using this medication to treat rosacea, apply benzoyl peroxide to your face. Avoid getting this medication into your eyes, inside your nose or mouth, on the lips, or on any areas of broken skin since it may cause irritation. If this occurs, flush the area with plenty of water. Wash your hands after applying this product. If using cleansers containing benzoyl peroxide, wet the affected area. Gently rub the cleanser into the skin for 10 to 20 seconds. Work into a full lather and rinse thoroughly and then pat dry. If too much drying occurs, you may need to rinse the cleanser off sooner or use it less often. Consult your doctor or pharmacist for further details. If you are using the liquid wash, cleansing pad, or cleanser bar, use it instead of soap once or twice a day. Wet the skin before applying, gently work up a lather for 10 to 20 seconds, and rinse thoroughly. Do not scrub the skin. If using the shaving cream, first wet the area to be shaved. Apply a small amount of the medication, gently rub into the area, and then shave. If you are using a cream, foam, lotion, or gel, apply it to the affected area as directed, usually once or twice a day. Before applying each dose, gently wash the affected area with a mild cleanser, then pat dry. Apply a small amount of medicine to the affected area and rub in gently. Some products may require rinsing off after application for a certain amount of time. Check your product package to see if your form of this medication needs to be rinsed off. If you are using the medicated pads or sponges, wash the affected skin with a mild cleanser, then pat dry. Wipe the pad or sponge gently onto the skin to apply the medication, usually once or twice a day to the skin as directed. The dosage is based on your medical condition and response to therapy. Improvement in acne or rosacea is usually seen after 3 to 4 weeks of use, and maximum benefit after 8 to 12 weeks of use. Do not increase your dose or use this drug more often or for longer than directed. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of Panoxyl Cream include peeling, itching, irritation, and reddened skin, especially at the beginning of treatment. If these effects persist or worsen, consult your doctor or pharmacist. Your doctor may recommend using smaller amounts of the cream or using it less frequently. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. Although rare, a serious allergic reaction to this medication may occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. In the US and Canada, you can call your doctor for medical advice about side effects, or you may report side effects to the respective health authorities. Before using Panoxyl Cream, make sure to inform your doctor or pharmacist if you have any allergies. This cream may contain ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, let your doctor or pharmacist know about your medical history before using this medication. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication may increase your sensitivity to the sun, so it's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. If you are pregnant, Panoxyl Cream should only be used when clearly needed, so it's crucial to discuss the risks and benefits with your doctor. It's also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using Panoxyl Cream, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. One product that may interact with Panoxyl Cream is dapsone, which is used on the skin. If Panoxyl Cream is accidentally swallowed, it can be harmful. If someone has taken an overdose and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical assistance by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It's important to use Panoxyl Cream regularly and attend all scheduled medical appointments and laboratory tests. This will help ensure you are getting the most benefit from the medication and allow your healthcare provider to monitor your progress and any potential side effects. If you are using Panoxyl Cream on a regular schedule and happen to miss a dose, use it as soon as you remember. If it's close to the time of your next dose, then it's best to just skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. Remember, consistency is key when using this product. When it comes to storing Panoxyl Cream, it's important to keep it at room temperature. Different brands may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. And when it comes to getting rid of any expired or unused Panoxyl Cream, it's important to do so properly. Don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.